Hey friends, it's Hansi Low here. 1 year ago, and today is the 29th of March 2021. 1 year ago, I was upset, angry, frustrated, locked in, and we had quiet streets all around in South Africa. Our first 3 week lockdown started, which lasted much longer than 3 weeks. But when I did my first initial calculation of the number of deaths that COVID would give and would cause in South Africa, I was shocked because my initial calculation said something like 360,000 deaths. And it worked on 60 million South Africa, or people living in South Africa, a total of 60 million. 60%, according to the government, would get it, so that's 36 million. I expected that 10% would go to hospital or would become quite ill, and that 10% of those would die. So that brought me to a figure of 360,000 deaths. Now, South Africa would normally have in a given year 450,000 odd deaths. So the question was, how many deaths would this cause and effect as a result of COVID in South Africa? And our government took certain steps to stop that, and they, in the beginning, they didn't tell us to wear the mask. The mask came only later, and I still find it excessively difficult to do, but I wear the mask where it is supposed to be worn. So there are many theories of where it comes from and what caused it and what didn't cause it, and I'm not going to go into that now because that's not the purpose. The purpose here is to say how many deaths could there probably be in South Africa, and what could our responsibility be. So just remember that I thought 360,000. Then it seemed like everything got under control in South Africa, we thought. And our lockdowns lifted, and we went to what we call a stage 1 or a first stage, which is fairly light, in October of last year, and we had some 50-odd thousand active cases at that stage. Come December, which is our peak holiday time, it seems that everything was under control the beginning of December, but then everything went out of control to the extent that we had a more serious lockdown again in January of 2021. And I'll show in a graph now what actually happened in terms of the cases and active cases. Where we came from the beginning of October to 50-odd thousand active cases, this ran away to a massive figure I've been tracking the COVID-19 stats in the beginning in South Africa very, very meticulously day after day for about 6 months, I think, maybe a bit longer than that. But then I stopped that, and then I only started tracking again on a daily basis on the 1st of January of 2021. Now, just to show you there, and I'm going to make it a bit bigger that you can see that this was the number of cases at the beginning of the year, the number of active cases, 157,000, and the number of deaths. And you'll see that it quickly went up to quite a number, a staggering number of active cases, going to almost 240,000, 239,000 at one stage. Now, if you look at a graph of this, let me just show you the graph of this. Then the graph shows that the active, and this is tracing the active cases, the active cases went up starting from 1st of January to that high peak of almost 240,000. The blue line is the actual daily ones, and the red line is the 7-day average. And at the bottom, the green, the gold or the yellow line tracks the number of deaths. So we're now in the end of March, and you'll see that the blue line and the red line is almost at the same spot. And if you look at the statistics that would represent, you'll see that the active cases in South Africa, and let me just go down to that, the active cases in South Africa is around 20,000 at the moment, 20,000, 21,000. So if you see that at the bottom there, That's what it is at the moment. And it will probably stay that way for a while, and it may go up slightly, but that is where it is at the moment. 20,000 instead of 239,000, which was the peak in 2021 in January. So what about the official figures? Some people argue and say, but our official figures are overstated. So they say that a lot of people died and would have died, and now we say it is as a result of COVID, of the virus, of the coronavirus, and not with the coronavirus. And some people say the other way around. So they say that the deaths are overstated, the deaths related to COVID. And then there's another group in the medical fraternity which says in South Africa that no. It's understated because we have tracked the deaths over the past 2 years, and now it's much higher now what it should have been. And again, I don't want to argue against any of the two different approaches, but I want to say, the only stats we've got is what the government is providing us, so we'll keep with that. And at the moment in South Africa, we have something like 52,500 deaths, and we have infections of 1.54 million, but 9.8 million people have been tested up to this stage. So if we look at statistics, if you just do a multiplication of that, you'll come to 300,000 deaths. Now, we don't know what will happen. We don't know to what extent the vaccines that they've promised that is coming, and to what extent that will impact us or not. That we don't know about new strains of the virus. So a lot of the things are very, very uncertain. But the question now is, what is our response? What can we do? Of course, the government says we've got to practice social distancing, and they just have different rules for social distancing. In a taxi, the social distancing is 6 centimeters, and normally the social distancing is 1.5 meters. If you're running outside, the social distancing should be 3 meters without a mask, and closer if you're wearing the mask. So there are different rules of social distancing and different rules in the church as well. So the church, you need more social distancing than in a taxi. But be that as it may, I'm not going to argue that point again today or at this stage, because this is not what this is all about. But the point is, look at your social distancing, be careful, not careless, wear your mask when you're supposed to wear it. But more important than that, make sure your immune system is strong. And part of having a good immune system is to make sure that you sleep enough, that you exercise enough, that you reduce your stress to the extent that you can reduce your stress. And something just like going for a walk, which is allowed, will help you to reduce the stress as well. So it could be as easy as going for a walk. Sometimes you need just a break away from your environment just to get to a new place and to be able to relax there, enjoy what is there, and enjoy nature. You want to up your fitness. So if you're walking 20 minutes a day, try to walk 25 minutes in the next day. And the other vital thing is, if you're overweight, drop the weight. Start doing something now. This is something you can control. You can control the amount that you're eating or not eating, and you can also control what type of foods you're eating. So my suggestion there is avoid the carbs and go more towards fats or proteins. And this is just general advice. You need to consult somebody on this, but drop the weight. So if you're weighing 130 and you should be weighing 90, then start on this journey. You can't change it overnight, but over time you can change that. Then vital for all of us is some of us have lost income, have lost jobs, have lost opportunities, is to say, how do I move to a place of creativity? Because when I move to a place of creativity, then something new can come from there. as opposed to a place from fear and from anxiety. And I understand if you lose your job, then of course there's a lot of anxiety, because now you think, I might lose my house, I might lose my car, I might lose. That's if you have that. And some people were affected very, very acutely with this, and I understand that. My prayer is that you will have the strength to recover from that. And it's a pity that we don't have a graph that shows us the number of people that died, let's call it economically. But at least this is not a permanent death. It's a place where you can recover from, although it may feel that it's like a permanent death. So if you don't have creativity, go to a place where there is creativity. Seek out friends that could assist you in the process as well. So we don't know how many people will die. It seems to me at the moment that the average number of active cases that we have in a given month will determine the average, or no, that will not determine the average, the total deaths of the year. So if our average for active cases for the year would come down to something like 80,000, then we'll have 80,000 deaths for the year. That's what the statistics works out at the moment. And it seems to me that we'll probably have, over the next 4 or 5 years, we'll still have the COVID or a variation of that amongst ourselves. And it's up to you to do the things you can to make your body strong, sleep enough, rest enough, eat well, exercise, and reduce your stress as far as possible. Of course, there are people that can pray for us as well. And I'm talking about praying for that creativity, praying for that sense of security that's not in us, but outside us, so that it could be in us, that we could feel secure within ourselves. So regardless of how many people will die in this year, regardless of how many mistakes the government will make or have made, or what routes they are on that we believe they are not, let's support where we can, and let's support each other as far as we can. And this is not only for South Africa, but also for the rest of the world. So my prayer for you is to survive and to also thrive in challenging times, in the COVID times. Let's chat again. Bye-bye.